I am Dr. Sandy Gomberg, Villanova Fitzpatrick College of Nursing alumna and primary author for this poster presentation representing the Philadelphia Department of Behavioral Health and Intellectual Disabilities. Philadelphia has taken the national stage in the substance use disorder crisis, and especially with the epidemic of the use of xylazine, an animal tranquilizer not approved for use in humans. Xylazine causes severe wounds throughout the body, well beyond infections at the injection sites. Persons who inject drugs and have xylazine-induced wounds often need post-acute IV antibiotics and wound care for 2 to 12 weeks and are not safe to discharge home or to a nursing facility. Therefore, they often remain in hospitals for long lengths of stay where there is a high risk for self-administered drugs and self-directed discharges leading to high readmission rates. And since the ASAM L4 hospitals that provide substance use rehabilitation care cannot provide IV therapy or wound care, patients requesting to go into rehabilitation are denied. 3 theoretical frameworks, the Federal Emergency Management Agency's Medical Operation Coordination Cell Model, Learning Collaborative Constructs, and Implementation Science, guided the design, implementation, and evaluation of the L4 post-acute pilot. Evidence-based and best practice requirements were defined for acute care and ASAM L4 providers to be eligible to participate in the program. The charts in the middle of this poster illustrate the defined patient care journey across the L4 post-acute pilots. Outcome measures were defined to monitor effectiveness of processes and the fidelity of the model. Our findings revealed that acute care hospitals can implement competencies, policies, and procedures to assess eligible candidates for an L4 post-acute program, accelerating the transition of care to a setting that can provide both substance use rehabilitation and post-acute medical care, which creates acute care capacity, reduces costs, and improves patient care outcomes. This pilot program demonstrated strong clinical outcomes and the estimated $4 million of savings to the PA Medicaid system. But most compelling, however, is the over 50% of program participants completed the medical treatment and continued to stay in substance use rehabilitation, access to which was prohibited before the L4 post-acute program. Healthcare leaders across the nation point to the substance use crisis as a priority impacting access, cost, quality of care for large numbers of the population and strain on the healthcare team. Nurse leaders can engage public, private, provider, payer, and community stakeholders to lead innovation to addressing quality cost, the healthcare of vulnerable populations, and supporting healthcare team engagement and satisfaction. Thank you.